Okay, so I'm back. We are still on the hematopoietic system. I try to stop at 45 because, you know, they say optimal studying. You study for 45, take a 10-minute break, study again for 45. You do that like for 3-4 blocks or some shit. Supposedly. I never really studied till now. Ugh. And so I'm like having to learn all these study like habits or whatever. I'm like so annoyed. I'm like, ugh. But I have my tea and we are on slide 39 of 63. Bro, my cousin is like harassing me to go out tonight because she's just going on all these trips, and I'm like, girl, I'm trying to study for nursing. Like, y'all know the grind. So we're gonna see how fast I can get through this and take the quiz that is due tonight. Hopefully we learn everything that we need to. All right, so the title, sorry, so all these sidebars. Anyway, so causes of neutropenia. Accelerated removal, drug-induced glycocytopenia, periodic or cyclic neutropenia, neoplasms involving bone marrow, idiopathic neutropenia occurring in the absence of other disease or provoking influence, Felty syndrome. So Felty syndrome, it sounds so familiar. I've heard that plenty of times, especially even though just starting out. So it is a rare autoimmune disorder characterized by the triad of rheumatoid arthritis, an enlarged spleen, and low neutrophil count, leading to increased infection risk. So your spleen is what cleans out your red blood cells. The neutrophil count is going to be what is your first defense against anything. So that's what you have the most of before you get to specialized white blood cells, right? So definitely important there. Initially, signs and symptoms of neutropenia, initially those of bacterial or fungal infection. So malaise, chills, fever, extreme weakness, and fatigue. Let's look up what malaise is so we can understand that. A general feeling of discomfort, illness, or unease whose exact cause is difficult to identify. So you just don't feel good. You can just say that. Anyway, and you have a reduced white blood cell count. Infectious mononucleosis. Definition: this self-limited lymphoproliferative disorder. Lymphoproliferative. Bruh, okay. Causes and characteristics. Caused by the lymphocytotropic EBV, a member of the herpes virus family, transmitted in saliva. This is why you gotta watch who you're kissing, okay? People who like to do that in bars. This is characterized by fever, generalized lymphadenopathy, sore throat, and the appearance in the blood of atypical lymphocytes and several antibodies. Highest incidence in adolescents and young adults. Treatment is symptomatic and supportive. Considerations: it enlarges the spleen and you shouldn't do contact sports. So is that like mono? Is that mono? Let's see. Tell me why I'm sick right now. My throat is sore as hell. And I could have sworn I got fucking ill from this kid. And I had all these symptoms. Oh, it is mono. Okay. So that's what mono is. The kissing disease. Infectious mononucleosis. See, we're connecting things. That's so neat. Okay. All right. Categories of disorders of hemostasis. Thrombosis, the inappropriate formation of clots within the vascular system. Thrombosis, okay. Examples include stroke, myocardial infarctions, pulmonary embolism, DVT. Bleeding, failure of blood to clot in response to appropriate stimulus. Examples include ITP, TTP, DIC, hemophilia. I'm pretty sure I have a discussion posted on this. All right. Why should your blood clot? Hemostasis is designed to maintain the integrity of the vascular compartment. So infection, volume, oxygen production, tissue damage, and healing. So let's say you get a cut. You're going to want your blood to clot, or you're going to end up bleeding out everywhere, and you're dead. That's it. You ain't got nothing stopping it. So that's an example of why your blood should clot. I'm gonna think next time I make a video like this, I'm gonna put on some makeup because I look crazy as hell. Next thing is hemostasis. 1, vessel constriction. Vessel spasms constrict the vessels and reduce the blood flow. It is a transient event that usually lasts minutes or hours. Vessel spasm is initiated by endothelial injury and caused by local and humoral mechanisms. What is humoral? Ding, ding, ding. Body. So body fluids, blood, all that. Okay. 2, formation of the platelet plug. Von Willebrand, VWF, factor binds to platelet receptors, causing platelet aggregation. So, and then development of blood clot, the coagulation process. So your vessel constricts, vasoconstriction. So it kind of like stops it, right? Then the platelets start plugging it up. Von Willebrand, so they're just like, ming, 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 the little things. And then they start to gather in the development of blood clot, and that is the coagulation process. All right, requirements for blood clotting process. Presence of platelets produced in the bone marrow. That it is produced by our stem cells. Von Willebrand factor generated by the vessel endothelium. Clotting factor synthesized in the liver using vitamin K. Why is vitamin K so important? It is because it assists in the clotting factor. That is why when newborns are born, they just shove them up with that vitamin because they're not born with it, supposedly. Or some shit. They don't have enough. So to prevent newborns from bleeding out, if you didn't know, they shoot them up with a shot of vitamin K. I think that's crazy. And they do that because their gut is sterile. Think about that. Their gut is sterile because they just came out of the womb, so they don't have any food or anything. And they've just been receiving nutrients through the placenta. So they shoot them up with vitamin K to prevent them from bleeding out. Why are they bleeding out? See, this is what happens when you get into conspiracy theories, when you learn about all this. Anyway, so vitamin K is a fat-soluble vitamin essential for blood clotting, bone health, and calcium regulation. It exists in several forms. The two most important are vitamin K1 and vitamin K2. Now we're going to look as to why you give babies vitamin K. Because I feel like you definitely should know that as a nurse. Like what, especially if you want to go and like help with children or whatnot. Newborns are given a vitamin K shot at birth because they are born with very low levels of this essential vitamin, which is crucial for normal blood clotting. Without sufficient vitamin K, babies are at risk for developing vitamin K deficient bleeding, a serious condition that can lead to dangerous bleeding problems, including brain damage and even death. Mind you, the only reason there was a high mortality rate for births were after doctors started assisting with births and we're going from touching cadavers to touching children and calculating the birth rate. And they're like, wow, everyone's just dying. Everyone's just like kicking the bucket when they give birth to a kid. I wonder why. You had no sterile practices. You were not clean. You also didn't know how to give birth. You're over here cutting women open trying to get them out. Like, yeah, a lot of kids died. A lot of kids die. But, you know, that's a whole nother argument for natural and holistic care. All right, back to our slides. Clot retraction and dissolution. Clot retraction and clot dissolution are also significant to hemostasis. This process begins soon after the clot is formed. The process involves the interaction of substrates, enzymes, protein cofactors, and calcium ions that circulate in the blood or are released from platelets and cells in the vessel walls. TPA is an activator produced in the injured tissue, converting plasminogen, plasmin digestless fibrin strand, causing the clot to dissolve. So this happens right after the clot is formed. The body starts doing what it needs to, and it helps loosen up the clot. Okay. Intrinsic and extrinsic coagulation pathways. Terminal steps in both pathways are the same. Calcium, factors X and V, and platelet phospholipids combine to form prothrombin activator. Prothrombin activator converts prothrombin to thrombin. Okay. This interaction causes conversion of fibrinogen and fibrin strands that create the insoluble blood clot. Okay, calcium, factors X and V, platelet phospholipids, these all combine to create the prothrombin, and then the activator converts it from prothrombin to thrombin, and this causes the fibrin strands that create the insoluble blood clot. All right. Increased platelet function. Hypercoagulability due to increased platelet function results in platelet adhesion, formation of platelet clots, and disruption of blood flow. The causes of increased platelet function are disturbances in flow, endothelial damage, and increased sensitivity of platelets to factors that cause adhesiveness and aggregation. So, increased platelet function, hypercoagulability. Yeah. General forms of hypercoagulability, conditions that create increased platelet function: atherosclerosis, diabetes, smoking, elevated blood lipoid and cholesterol levels, increased platelet levels, pregnancy in the puerperium, use of oral contraceptives, post-surgical state, immobility, congestive heart failure, malignant diseases. All right, atherosclerotic plaques and platelets. Atherosclerotic plaques disturb blood flow, causing endothelial damage and promoting platelet adherence. Platelets that adhere to the vessel wall release growth factors, which cause proliferation of smooth muscles and thereby contribute to the development of atherosclerosis. Smoking, elevated levels of blood lipids and cholesterol, hemodynamic stress and diabetes mellitus. I'm not saying that right. Predisposed to vessel damage, platelet adhesion, and eventual thrombosis. Hemostats test commonly ordered. Platelet count, seen on a CBC, collected in a purple. Top 2 contains EDTA. PT, prothrombin time, how is the blood clotting? INR, uses the PT to come up with the standard international normalized ratio. This is what is used in PT taking warfarin. PTT/PT uses coagulation protocol for titration of heparin and fibrinogen. And then she has like an example: platelet defects, thrombocytopenia, too low platelet count. This is a result from decrease in platelet production, increased sequestration of platelets in the spleen, increased platelet destruction. Types: drug-induced thrombocytopenia, idiopathic thrombocytopenic purpura, thrombocytopenic purpura. So ITP, TTP, and drug-induced thrombocytopenia. I'm definitely going to have to look at this slide again for my discussion. Coagulation defects. Deficiencies can arise because of defective synthesis, inherited disease, or increased consumption of the clotting factors. Hereditary disorders: hemophilia A, hemophilia B, von Willebrand disease, any genetic disruption of the production of clotting factor, and vitamin K deficiency. The liver produces an active clotting factor, resulting in abnormal bleeding. Manifestations of thrombocytopenia. Bleeding! It says that in all caps and like fucking 45 font. Mucous membranes, which consist of the nose, mouth, gastrointestinal tract, and uterine cavity. Commonly occurs in small vessels. Petopsia, pinpoint purplish red spots, seen almost exclusively in conditions of platelet deficiency. Purpura, purple areas of bruising. Causes of bleeding: decrease in the number of circulating platelets. Depletion of platelets must be relatively severe before hematopoietic tendencies of spontaneous bleeding occur. Impaired platelet function. Bleeding resulting from platelet deficiency commonly occurs in small vessels and is characterized by petechia and purpura. Like, you know when you see old people and their like skins are like purple and you're like, what in the world is that? That's this. Like, I don't know how to show you, I'm not gonna lie. I guess meh. See it? You see it? Yeah. Okay. I don't know if you saw it, but close enough. Vascular disorders that cause bleeding. Hemorrhagic telangiectasia. I feel like I'm getting fucked with. Like, what is all, like, who came up with these? I feel like I'm reading, like, species names. Like, hemorrhagic telangiectasia, an uncommon autosomal dominant disorder characterized by thin-walled dilated capillaries and arterioles. Vitamin C deficiency, scurvy, results in poor collagen synthesis and failure of the endothelial cells to be cemented together properly, causing a fragile wall. Cushing's disease. Cushing's disease causes protein wasting and loss of vessel tissue support because of excess cortisol. Senile purpura. That's shade. Senile, wow. Purpura, bruising in elderly persons, caused by the aging process. Okay. So all of these cause bleeding. Now this is an important slide. ITP versus TTP. TTP is autoimmune related. It is caused by acquired inhibitory autoantibodies against ADAMTS13. Can rarely be genetic due to inherited mutations. ITP, on the other hand, is defined as an acquired thrombocytopenia with a platelet count of less than 100 caused by immune destruction of platelets. The disease of platelet quantity, the remaining platelets function normally, there are just not enough of them. Platelets are destroyed by pathologic antiplatelet antibodies, impaired megakaryocyte production, and or T-cell mediation destruction of platelets. No apparent triggering mechanism or underlying condition. Causes of secondary ITP are numerous, but include autoimmune conditions, rheumatoid arthritis, autophospholipid syndrome, infections, MMR, vaccination, blah, 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 hepatitis C, HIV, COVID-19, ming. So it's caused by a bunch of shit and they don't know. Disseminated intravascular coagulation, DIC. So DIC is hallmarked by a consumptive coagulation pathway where the coagulation system is massively activated everywhere in the body instead of locally at sites of tissue injury, such that coagulation factors ultimately get depleted, leading to simultaneously bleeding and clotting. Okay. An initial insult exposes blood to large amounts of coagulants, such as lipopolysaccharides and gram-negative bacteria. Trauma resulting in vascular endothelial damage that exposes the blood to proagulant substances. Placental damage from trauma associated with pregnancy or retained products of conception, resulting in massive tissue factor, TF, generation. Cancer cells producing tissue factor, severe intravascular hemolysis, resulting in release of procoagulants from lysed cells. Okay. I'm about to fall. Alright, conditions associated with disseminated intravascular coagulation, DIC. Obstetric conditions, cancers, infections, shock, trauma, surgery, hematologic conditions. And then she has another slides for us to like view and shit. And that's really it. Okay, we are done with her cliff notes of the textbook. Now, let's go to our book, Lippincott. I wonder who wrote this. Maybe they're in the files. Let's see. All right, we're taking a quiz right now. Chapter 1, blood cells in the hematopoietic system. We're going to do 20 questions and we're going to see what we get. A client with right lower quadrant abdominal pain is suspected to have acute appendicitis. When assessing the laboratory studies, which results would the nurse know indicate this client has an acute affection? I would say an increase in T lymphocytes. A nurse is examining a client's laboratory results. Which result does the nurse use as the best evidence that the client has an active acute bacterial infection? Elevated neutrophil count. Well, it says elevated white blood cell count also. And what the hell is band cells? Why is that an option? This is the second time I'm seeing it. Band cells are immature neutrophils with a band-shaped nucleus serving as an early defense in the immune system and indicating infection or inflammation when elevated. Why the hell did we not go over this? I'm done. I'm gonna cut the fucking show, bruh. It could be any one of those. Elevated white blood cell count, that's neutrophils. Neutrophils are white blood cells. So are band cells if they're early neutrophils. So, and it's definitely not a decreased number of lymphocytes if someone has an acute bacterial infection. How about we do white blood cell count? Has an acute. So it's not systemic. I'm going to say white blood cell count because it's over. This is what pisses me off, bruh. Which type of white blood cells are related to connective tissue mast cells and respond in allergic and hypersensitivity reactions? I thought that was eosinophils, but that's not an option. Basophils, granulocytes, B lymphocytes, and neutrophils. I would say basophils, right? Because they are hypersensitive and allergic. Which type of macrophages are found in the liver? I really only remember talking about monocytes, so we're just going to put that. A nurse is caring for a newborn that has developed a low platelet count. What could be the cause? Increased pluripotent stem cell division? Definitely not. Increased megakaryocytes? Decreased thrombopoietin? Decreased spleen function. So spleen is what controls basically the recyclation of the red blood cells, correct? Right? Now we're like seeing if my brain works. I'm going to say decreased thrombopoietin. Because the other things create create platelets, right? Definitely the stem cells do. The globulins that make up part of the plasma of the blood have 3 distinct purposes. What are the gamma globulins? What are gamma? We're Googling that because we didn't go over that. What the hell? Mind you, I have to do this for each one. Gamma globulins are a class of blood proteins, primarily antibodies, that play a crucial role in immune defense and can be measured or administered therapeutically to support immunity. Wow. So antibodies of the immune system? Did I just read that and it just go past my head? Yeah, they support immunity. Okay. Just not like digging off over here. A client diagnosed with pancytopenia due to aplasmic anemia is scheduled for which treatment that could correct bone marrow deficiencies? Stem cell transplant. That's treatment. What the hell? Whole blood transfusion. What the fuck are you doing with that? Alright, which leukocyte is correctly matched with this function within the body? Basophil engulfs antigens. Monocyte releases heparin. Lymphocyte, phagocytosis. Eosinophil, allergic reaction. We're going to do eosinophil, right? The nurse is reviewing a laboratory analysis of fluid collected from a client's wound. Which characteristic does the nurse use to determine if the fluid flows from the interstitial versus the intravascular space? pH level under 7.35 supports the fluid is from the interstitial space. Positive test for bacteria supports that the fluid is from the intravascular space. Presence of protein support that the fluid is from the intravascular space. Discharge volume of greater than 30 milliliters per day supports interstitial fluid. This was also not in our Cliff Notes. Okay, so I don't know what the fuck to put. We'll just do the pH and we'll come back to that. Client undergoes a splenectomy, I'm not saying that right, following an automobile accident. The nurse monitors for which anatomical change that most likely to occur following surgery. Increased white blood cell count. Infection. Hello. A nurse is evaluating laboratory results of a client diagnosed with a parasitic infection. The tests reveal a large group of cells that are membrane bound with granules in their cytoplasm that are aiding the destruction of the parasite. Which cell is the nurse evaluating? Eosinophil, lymphocyte, monocyte, macrophage. I want to say it's either monocyte or macrophage. I know it's M. We're going to do monocyte. I don't know. The nurse's review of a client's laboratory results indicate that inflammation is absent and platelet levels are low. Which test was performed to provide the platelet count? Hematocrit? But wasn't the hematocrit the amount of red blood cell percentage inside the blood? So maybe not that. A complete blood count? Sedimentation rate, bone marrow aspiration. That's definitely not it. We'll just do complete blood count. I don't know. Which type of cell the most common leukocyte in normal blood? Neutrophils, right? A client comes to the clinic with a runny nose and scratchy throat. The nurse is evaluating the white blood cell count, which shows an elevated number of white blood cells and an increased percentage of eosinophils. What is the most likely cause of the symptoms? Allergic reaction, I would assume. Stem cell transplantation has been shown to provide potential cures for diseases such as aplastic anemia and the leukemias. What are the sources of stem cells used for transplant? Bone marrow, correct? Bone marrow and immature neurocells. That's the immature neurocells is what's getting me, I'm not gonna lie. 6-year-old child is having a stem cell transplant using umbilical cord blood. What benefit does the nurse understand that this type of transplant will have for the child? This type of transplant creates less risk of graft versus host disease. The child will not have to take any form of chemotherapy. There are no side effects to this type of transplant. Wrong. There could always be a side effect. This type of transplant does not require an inpatient stay in the hospital. Maybe chemotherapy, because chemotherapy kills everything. The client should, but that also could be wrong. Which client should the charge nurse assign as a roommate for a client diagnosed with aplastic anemia? Well, they already have a weakened immune system, so client with bacterial pneumonias, Client interaction with a broken femur, that one for sure. Client with impetigo, what the fuck is that? A highly contagious bacterial skin infection? Oh, hell no. Client with bacterial meningitis, broken femur. When a white blood cell with a differential count reveals an acute infection, which statement is correct regarding the client's neutrophils? Neutrophils are the first white blood cells to elevate an acute infection. There are fewer neutrophils in the blood. Their white cells are not present, are only responsive. It's the most. A nurse is reviewing the complete blood cell count, CBC, and white blood cell, WBC, differential of a client admitted with lower right abdominal pain. Which laboratory results are the most important for the nurse to communicate with the healthcare provider? So we didn't go over percentage because she said not to. She said understand the concepts more. So we're just going to do a shot in the dark, and I'm just going to pick a random one. Okay. Which colony stimulating factor CSF is given to clients with end-stage kidney disease to help with chronic anemia? Erythropoietin, I would assume. Ugh, I don't want to look at our results. Okay, my results. Ugh, failed. Okay. Let's see. An increase in bands? Oh, hell no. We didn't even go over that. A client with right lower quadrant abdominal pain is suspected to have acute appendicitis. When assessing the laboratory studies, what results would the nurse know indicate this client has an acute affection? An increase in bands, which we have found, is early neutrophils. So I guess the early neutrophil bands are going to hit first, then the neutrophils, then the other bullshit. All right, the nurse examining a client's laboratory results. Which results did the nurse use as the best evidence that the client has an active acute bacterial infection? Again, elevated number of band cells. I'm so over this. Which type of white blood cells are related to connective tissue mast cells and respond in allergic and hypersensitivity reactions? Basophils, we got that right. Which type of macrophages are found in the liver? Kupffer cells. Great. A nurse is caring for a newborn that has developed a low platelet count. What could be the cause? We were correct. Decreased thrombopoietin. The globulins that make up part of the plasma of the blood have three distinct purposes. What are the gamma globulins? Antibodies of the immune system. A client diagnosed with pancytopenia due to aplastic anemia scheduled for which treatment that can correct bone marrow deficiencies? That's going to be a stem cell transplant. Which leukocyte is correctly matched with dysfunction within the body? Eosinophil, allergic reaction. The nurse is reviewing a laboratory analysis of fluid collected from a client's wound. Which characteristic does the nurse use to determine if the fluid was from the interstitial versus the intravascular space? Presence of protein supports that the fluid is from the intravascular space. Client undergoes a splenectomy following an automobile accident. The nurse monitors for which anatomical change most likely to occur following surgery. Increased white blood cell count. Got that right. A nurse is evaluating laboratory results of a client diagnosed with a parasitic infection. The test revealed a large group of cells that are membrane brown with granules in their cytoplasm that are aiding in the destruction of the parasite. Which cells is the nurse evaluating? Eosinophil. The nurse review of a client's laboratory results indicate the inflammation is absent and platelet levels are low. Which test was performed to provide the platelet count? Complete blood count. Which type of cell is the most common leukocyte in normal blood? That's going to be neutrophils. Client comes to the clinic with a runny nose and scratchy throat. The nurse is evaluating the white blood cell count, which shows an elevated number of white blood cells and an increased percentage of eosinophils. What is the most likely cause of the symptoms? Allergic reaction. Stem cell transplant has been shown to provide potential cures for diseases such as aplastic anemia and the leukemias. What are the sources of stem cells used for transplant? That's going to be umbilical cord, blood, and bone marrow. Okay, so bone marrow is right, but umbilical cord blood. A 6-year-old child is having a stem cell transplant using umbilical cord blood. What benefit does the nurse understand that this type of transplant will have for the child? This type of transplant creates less risk of graft versus host disease. Which client should the charge nurse assign as a roommate for a client diagnosed with aplastic anemia, client interaction with a broken femur? When a white blood cell with differential count reveals an acute infection, which statement is correct regarding the client's neutrophils? Neutrophils are the first white blood cell to elevate in acute infection. The nurse was reviewing the complete blood count, and white blood cell differential of a client admitted with a lower right abdominal pain. Which laboratory results are the most important for the nurse to communicate to the healthcare provider? White blood cells. Which colony stimulating factor, CSF, is given to clients with end-stage kidney disease to help with chronic anemia? Erythropoietin. Okay, so I feel like we did okay. Now we know the right answers and why. Oh, let's take another test. I can't believe this is over 4 chapters and all we had is 4 days. Like, these summer classes are literally no joke. Here, chapter 2, disorders of hemostasis. I'm not gonna lie, this is so fucking annoying. Alright, 20 questions. I wonder how the other kids are studying for this. A client has an impaired platelet function that may develop from inheritance, drugs, disease, or extracorporeal circulation. The healthcare provider would document this as... Is it Dick? Fibrosis, plasmapheresis, thrombocytopathy. I'm gonna take a break. This is just like hurting my head at this point. Oh my god. And the quiz is only like 10-15 questions, so it's like whatever you like. I might have to just do what I did for the first one and just say fuck it and see what happens. Fuck a wee ball. But yes, those were the main cliff notes for this lesson, for this unit, essentially. I'm going to start just looking more at the quizzes and the prep you from the book and seeing how far I get. And then I'm just going to have to take it because it's due tonight and it's lockdown browser. But yes, I hope this will help aid in my studying in the future. Good luck, you. Good night.